What's up, guys? Today we're going to be talking about our hip bone or innominate bone, and it's formed by our two os coxae, which is two different bones that form our hip or our innominate bone. Okay, and we're going to also include some important ligaments and structures and foramen that are included with our hip. So our first ligament that's quite important is this one right here. It's our inguinal ligament, and that's a superior border to our femoral triangle, which is a space where our navel structures pass through, and I'll get into that in another video. So that's our navel structures go through our femoral triangle. And then we have these two spaces in the back, and it's our greater sciatic and lesser sciatic foramen. It's foramen because it's closed off, okay, and our greater sciatic foramen is closed off by our sacrospinous ligament, and our lesser sciatic foramen is closed off by our sacrotuberous ligament. Sacrospinous, that S, you can help remember that by superior. It's superior, closing off that greater sciatic foramen. All right, and so we have our os coxae here, which is one portion or one side of our hip, and it's formed by three different separate areas. Okay, it has our ilium, our ischium, and our pubis. So we're going to dive into that a little bit deeper. All right, so once again, it's made by our ilium, which is superior and posterior, our ischium, which is inferior and posterior, and our pubis, which is anterior and inferior. All right, so we have our area separated out here. So our pubis is once again inferior and anterior. Our ischium is in the middle. It's intermediate to our ilium and pubis. And then our ilium is superior and posterior. So once again, our ischium is inferior and posterior. Our pubis is anterior and inferior. And our ilium is posterior and superior. All right, so we have a couple different landmarks on our os coxae that are important. Our greater sciatic notch. It's a notch because of the sacrospinous ligament closes it off, making it a foramen. We have our auricular surface, which forms our sacroiliac joint with our sacrum. And then you have our iliac crest, which is a superior border, and it's very long and rigid portion of our ilium. Our iliac spine is just inferior to that. We have our anterior superior iliac spine, a very important landmark, our anterior inferior iliac spine, our posterior superior iliac spine, and you can guess it, our posterior inferior iliac spine. All right, we have our ischial spine, which is superior portion of our lesser sciatic notch. Once again, it's a notch because our sacrotuberous ligament will close it off, making it that foramen. We have our ischial tuberosity, which is inferior. Our pubic tubercle, part of the pubis. And then our obturator foramen, where we have our obturator artery, nerve, and vein that go through it. Okay. And we're going to go to another section of it, more lateral side of our hip, and we have our acetabulum. All right, so we have our acetabulum, and we have our lunate surface, which is right up and around it, and it looks like that lunar eclipse, right? That's why it's called the lunate surface. And this is where our femur is going to sit inside of it, forming our hip joint. And this is very common for total hip joint replacements and things of that such. That is where they're going to be navigating and working out of. Now, once again, on our lateral side, we're going to have three important lines. There are gluteal lines. So we have our inferior, which is inferior to our anterior and posterior gluteal line. Keep in mind, look how the posterior is actually superior, but it's more posterior than that of the anterior gluteal line. All right, guys, thank you all for watching. And if you guys have any questions, leave them below. Thanks.